anybody out there who's hearing about ERS for the first time, I think this is something that they'll really feel enthused and excited about.
This is a revolutionary system that we're leading here.
I think this is really going to enable East London to transform, to really provide better care.
It is a great opportunity to work more efficiently and we'll enjoy our jobs better. I'm excited about it and I'm sure my colleagues will also be similarly excited.
This is a really powerful tool technologically to enable us to do a lot of the things we've been wanting to do for a long time.
We're changing the way that we're delivering our healthcare.
Get ready for ERS.
ERS is the electronic referral service, which was formerly known as Choose and Book.
There's a national drive to cut paper referrals and switch to electronic, and I think we can use that opportunity to think, actually, do patients really need to make the journey to hospital?
From the 1st of October 2018, all GP practices will refer to hospital outpatients via an electronic means.
This transition is definitely overdue. If we look around us, everything has progressed. I can now sit on an underground train and order a pizza. So why can't we provide a healthcare system where we don't necessarily have to send a patient using a dictaphone and a secretary with a letter and make them wait 3 months to an outpatient appointment, which they might not have even needed in the first place.
There are 3 main modalities to refer a patient to an outpatient clinic. The first would be just to book as we would previously, where we would select a outpatient clinic for the patient to choose an appointment to go and be seen at. But the 2 new modalities are RAS, which is a referral assessment service, and also advice and guidance.
Advice and guidance is a service whereby a GP can write about a specific patient to a consultant who creates a 2-way conversation.
The GP sends an electronic message to the consultant that they've got such and such an issue.
And that allows us to have a 2-way conversation, just like an email, where you can ask a question and I can give advice really quickly. Within a day or so, the GP can then tell the patient what the plan is. And at the end of that conversation, if we think that the patient should come to clinic, we recommend that to the GP.
I had a patient recently who came to see me who was seen by a consultant in the hospital, by a cardiologist, who advised, please refer this patient to haematology. I was not convinced in myself that this patient needed to see a haematologist, and I think this would have been an unnecessary wait for 3 months to have an appointment. So I had a look at the cardiologist letter and I used the advice and guidance service and spoke to the haematologist directly. Went through the patient's history quickly and asked the haematologist advice. Within 24 hours, that haematologist wrote back to me with advice saying, this is all we need to do. And I was able to call that patient the very next day and tell them that.
The referral assessment service actually gives control to the consultants to decide if a patient needs to be booked in their clinic or not.
The RAS service, which is a way that patients can be referred in for the consultant to actually triage at the point of referral, rather than having to see the referral for the first time when they meet them in an outpatient clinic.
RAS, the referral assessment system, is slightly different in the sense that the GP does write to the secondary care consultant, but then the power goes to secondary care to decide what next to do with the patient.
We get a referral into the referral assessment service and we then provide advice and send that advice back in a lot of cases. In some cases we will want to book them directly into a clinic, in which case we will do that ourselves.
So it saves a step not only for the patient but also for the hospital in multiple appointments.
For the patient, if they do need to come to hospital, we can speed things up really by getting the test done before they come to see us, and that really speeds up the entire patient pathway.
Having utilised the software myself and used it for my patients, it is absolutely fantastic.
Using the ERS system is really easy. You could generate a referral from beginning to end within a minute. So all I would do is go to the referral section in the clinical system and then choose the ERS referral pathway, and that will launch the ERS system. And what that will then allow me to do is choose a speciality for the patient, select whether it's a routine referral or an advice and guidance, and then select the services. Once I've done that, I'll get a list of services that will then appear, and I will then be able to select a service to refer to, or click on the RAS option to send a referral through the referral assessment service. And that's it, and it's really straightforward and really quick to do.
Training our colleagues and training everyone alike is absolutely essential, because what we want to do is we want everyone to be happy with what we're using.
Training is important, but also engagement, because what we want to be doing is rolling out this process so that everybody's confident in the use of the system.
We're rolling out training in 3 different ways. So number 1 is we are holding some webinars or some online training for colleagues where we'll provide about 45-minute videos with a 15-minute Q&A session for colleagues to have a look at how they can access the system and how to utilise it. The second way we're doing it is to actually go and do some practice visits. And the third way that we're going to go about doing that is through locality meetings and roadshows, where we talk about having some screenshots, giving a presentation about how we go about doing that. So again, there's loads of different ways for people to access the learning and the training.
Point of view of the user, so this is the consultant, the GP and the patient, it all looks the same. It's all the same software, the same buttons, and people can be led through it in the same.
We want to be there in a supportive role, providing that training to ensure everyone is happy going forward as we revolutionise how we deliver our healthcare.
For anybody out there who's hearing about ERS for the first time, I think this is something that they should really feel enthused and excited about, because this is something that will really revolutionise the way that we deliver care in future.
The thing that's made this really easy for me is that this is the right thing to do for patients.
This process will improve the patient experience by actually improving patient care, but also reducing unnecessary attendance at hospitals.
So certainly it will save me time, my team time in the back office, and also give me time to spend more time with patients, really focusing on their care.
We will only need to see the patients we really need to see in clinic. Our waiting list will come down.
One of the things that this will enable is that there'll be much better relationship between primary and secondary care clinicians, which is something we have been lacking. One of the things we really want to try and do is make that a reality, so that information just flows to the right person at the right time with the right governance in place.
The East London patient records access will improve. I often call it the IT glue, when actually patients can have access to their records, but all clinicians can have access to the records, so you're not actually missing any data. All in all, it becomes a better experience for all of us concerned, and that's what we want to be doing. It's a win-win everywhere, because at the end of the day, we want to have enjoy our work and get best care for our patients.
So this is going to be a massive change for the NHS and how we deliver our healthcare service, and we're only just getting started.
I think it has that potential to transform East London and how we look after our patients. I really do believe that.
Get ready.
Get ready.
Get ready for ERS.